Hi there. Here we are with our patient Rolando. Rolando stopped by the office today for an 8-month follow-up visit after we did a Max Harvest Plus hair transplant procedure. When we do that plus, what that means is we're just trying to get as much hair as we could get, and we ended up hitting a home run for Rolando. We got 4 huge strips. I forgot exactly what. Do you remember what I told you? How much hair we got you?
A lot.
A lot.
I believe it was 12,000.
About 12,000 hairs. So Rolando did have a previous surgery from a local doctor. 2 previous surgeries. And how would you say your results were from those 2 previous surgeries?
I would say number 1, the post-operative recovery from here was significantly better than there. After those surgeries, I was in a lot of pain for like 2-3 days. Here, I felt some discomfort the very first day, but after that, I didn't use any pain pills whatsoever. At the previous surgeon that I went to twice, and I was happy with, because I didn't know any better, I will say that, his sutures were immediately obvious to anybody that saw my head, because I cut my hair pretty low. So everybody knew I had some procedure done, because you could see the U shape in the back of my head. With yours, the sutures were so nice and so tight and so small that even my barber, who cuts my hair this low, had no clue that I did a procedure. Not one.
That's great to hear. And thank you for sharing that with us. Now, would you say the overall results from your 2 procedures, were you happy with those in the beginning before you saw what we did?
Okay, again, because I didn't know any better, I was actually happy with that surgeon. That's why I went twice. Because again, I thought that was the best you could do and the best you could get. And yours, well, this is the funny part. Yours already at 8 months is as good as his was as a permanent fix. I will tell you that, and I'm still halfway through the process, so there's a lot more hair to come.
Yeah, when we do these big cases, it takes a solid 18 months. He's only at 8 months, so he had believe it or not, this was a late start of growth, but he's already seen miraculous results at this stage.
And I was going to say the biggest difference too, besides the suture, which was huge to me, in what you did and what that previous surgeon did was, you know, for anybody, I'm a top level executive, I'm a senior vice president, and I go to high level meetings, and I was concerned that, okay, if I do this procedure, I'm going to go to these meetings and people are going to know I did something and look at me weird, and it's been completely oblivious to everybody. No one even knows I did anything.
That's excellent, man. Yep. I'm super happy for it. All right, I'm just going to kind of show you off a little bit. Just kind of took your chin like that for me. So what we did is we started all the way up front, created the nice natural looking hairline, went beneath where he had previous grafts, blended all the way through to the back. He's got to go back to work, so I'm not going to mess his hair up right now. And then I'm just going to kind of show off your suture line here. Kind of put your head back now towards the camera. So there's the back of it. This was literally like a class 6. And just kind of look regular. I'm going to just show the suture line. Now he's had 2 previous surgeries here. So when you look at this, I'm going to show you where holy crap. You can't even see it, man. Look at this.
That's fantastic.
Wow. Okay.
I'm done. My barber
did
not know.
So I take on these big cases all the way. Jesus, that's amazing. Look at this. That's it. Holy smokes, brother. Look at that. This would be it right here. Look at this, Josh. This right here. See this line? So this line would follow all the way through here like this. And you can't even see it over here, but this would be going through here like that. It's just undetectable. It's like this would be the line right there. You can't even see it, Rolando.
I agree.
It's like unbelievable. But let's check the back out here. So this is the line going through here. You can kind of slightly see it there. So that's where we got it from, right there. So you can just kind of follow that around. That's where we're getting it from, okay? So kind of follow that line. Here we go over here, okay? Now, this is our line there. This is his old surgery. This is from another doctor. So this is typical for what we see in other surgeries. So that's an old scar from another doctor, not here. This is part of that old scar from another doctor, not here, okay? And now let's compare that to what we're doing. you can see the two lines. This is ours here. Excuse me, this is the scar here. This is ours here. See that line above? So our little line would follow through here like this, which you can't even see. Can't even see it. It's unbelievable.
And the irony is,
that's the old one.
The other doctor who did 2 procedures
got it.
probably didn't move half the hair that you did in 1 procedure.
That's
So-
insane but true.
So your old suture line is like the size of a popsicle stick.
Yeah.
The suture line I gave you is not that wide. It's not even close to being that wide. I couldn't even see it. It is like literally like, it almost looks like a sheet of paper. You're looking at the edge of a sheet of paper.
Like I said, the proof is in the pudding when
So-
your barber doesn't
Yeah.
know.
So your results are phenomenal.
I appreciate
and
it.
he's got a lot of growth to go. So congratulations.
And thank you.
Thank you for doing the video for us. And I hope you will come back and do another follow-up video once it fully grows out.
You guys call me and let me know.
Have a
And I'll
thanks,
be
man.
here.
Congrats.
Say hey, no, congratulations to you.
Thank you.